you have any missing teeth? Or do you know someone with missing teeth? Well, many people don't want to be walking around these days with this gap for most of their life. There are a number of ways that your dentist can help with this gap. So in this video series, we will be talking about some of these, including a bridge, a denture, and a dental implant. Hello, I'm Dr. William Park with Bless Smile and Smile on You Dentistry. Today we will be talking about the pros and cons behind implants and dentures, which are 2 out of the 3 ways that your dentist can help you replace your missing teeth. So let's get started with the most cutting edge, the most advanced, but also the most conservative way of replacing your missing tooth, which is a dental implant. If you're not familiar with what an implant is, a dental implant is a small post that gets placed inside of your jawbone and is allowed to fuse with the bone for a few months before we place the final restoration on top of that. Many people think that the implant is a whole unit, including the part that gets fixed into your jawbone and then the tooth on top of that. But the implant is actually just the part that gets fixed into your jaw, and then from that we can either put a crown if it is just a single tooth, or it could also be used to support a whole denture if you are missing multiple teeth. The biggest advantage to the dental implant is that we are just replacing the one missing tooth without affecting any of the teeth that are around that. I would say that the biggest con is that it is a little bit more of a surgical procedure compared to some of the other options. And it can also take a few months before your bone is solid enough around the implant for us to put the final tooth on top of that. I know that hearing that you have to go through a surgical procedure brings up all of these kind of nasty images in your head, but I can promise you that it is nothing like the kind of surgeries that you were imagining. With modern techniques and advancements, we often don't even need to open up your gums before placing the implant. The second option for replacing some of your missing teeth would be something like a denture. As you may already be familiar, a denture is an acrylic plate where we have some plastic teeth that are anchored to that. Sometimes it may have some additional metal or plastic hooks around them that do hook onto the rest of the teeth, so the denture is not moving around as much. Some people may also find these clasps around the teeth a little unappealing just because they will show when you do smile. A great advantage to the dentures are that they can be quite affordable. They are also fairly conservative because we do not need to touch the neighboring teeth too much to get the denture to anchor to them. However, the cons can outweigh some of the pros in this case. Many people do not like that the dentures do have to go in and out, as opposed to the bridges or implants which would be fixed inside of your mouth. Because the dentures are designed to go in and out, they can kind of have some movement as you're eating and talking and things like that, as you may have seen in some of the online videos. So dentures can be a great option for you if you are looking to replace the teeth just when you smile, but unfortunately the dentures won't be as good for when you are eating or chewing different things. And it's also important to keep in mind that the denture may not look as aesthetic or as pleasing to the eye as some of our bridge or implant options, just because of some of the clasps that do have to go around the teeth. So I hope that gave you some insights on things to consider when you are thinking about getting some implants or dentures to replace your missing teeth. If you are in the Orange County area, we would love to have you come in for a consultation or to discuss some of your dental concerns. You can find us at smileonyoudentistry.com, and thank you for watching.